Okay, we're going to get started. I'll start with some opening remarks. So my name is Chantal Antone. I'm the Indigenous Health Lead for London Health Sciences. Been at London Health Sciences now for about 12 years, working with the First Nation Inuit Métis urban Indigenous community for the first, what I'll say is the first 8 years of my role here. I was working in oncology, so I worked for the London Regional Cancer Centre. It's now the Verspeeten, but I worked there for about 8 years, working across the Southwest regional region, working with all of the communities. So there's about 10 communities, 10, 11 communities in the Southwest region. So my experience, I would say, is really a broad stroke across the geography for Ontario. And then in the last couple of years, some of you may know that I was then I moved into the role of the Indigenous Health Lead here at London Health Sciences. So a lot of our work is focused on education for the past year and a half. So I'm really happy to see everybody here today and welcome you to this, to this important event. I would like to give a shout out to Colleen, who's been able to, really be the backbone to coordinating these events, along with Sean Tucker, our communications partner and consultant. And a huge shout out to Sadie from the Schulich School of Medicine, who's helped us with getting our partners online from Western, with the residents and some physicians. So we will have Western students and residents and physicians online through the live stream, and I'll talk to that a little bit. So today, as we meet for National Day in Truth and Reconciliation, we really come together as Team LHSC, and we welcome guests from Western's Schulich School of Medicine. And really the purpose of today is reflect on the profound and really the difficult truths of Canada's dark history. So today we will begin by raising the Every Child Matters flag at our hospitals, and we will be lighting the Children's Hospital atrium in orange. And so we are continuing our recognition on today for the Truth and Reconciliation, and now with an important a learning opportunity. So for the past couple of years, the Indigenous Health Team and myself and Colleen Jewell, have been arranging cultural sensitivity trainings and education opportunities for Team LHSC. To date, we have had about approximately over 2,000 staff attend different events around the lunch and learns, the webinars, the in-person trainings. So we're really happy to see the uptake and really the interest from Team LHSC to attend those events. So these opportunities like today are made possible through the funding through the Ministry of Health. They have granted us a grant for cultural awareness training to improve. The goal of that is to improve awareness of Indigenous peoples and the impacts of residential school and that legacy on Indigenous people coming to the hospital. But it's also an opportunity really just to learn about the truth of past, but how it impacts today. So for those who are watching on the live stream today, I would ask that you fill out the form that we will be placing in the chat window. So I believe Sean Tucker will be placing something in the chat, and we will use this information to report our training activities to the Ministry of Health. So we ask everyone on the line, please sign in. The ministry is really asking us to be able to report on the folks who are attending. So while today is a reminder of the legacy of Canadian residential schools and the children who never made it home, it is also a day for hope and a day for us to listen and learn and to move forward together. So just a quick personal note from myself and the the close impact and the I guess really the legacy of Indian Residential School is I went to what we call a day school, and my father was actually a survivor of the first residential school that opened in Canada, which was what we call the Mush Hole, but it's the Brantford Indian Residential School. And so my father went there, and so when we think about the legacy of residential schools, although it is a part of the history, it is also a part of today's context. And I really want to focus on the strength of that, that I'm here today with my team, and you can see how big my team is here. They're in the front line every day doing the work, working with patients and families and working with the communities. But it's 2025, and we have someone like myself and folks like the Elder Chris George to be able to be here and to speak with you and to have the opportunity to be in these spaces. So I'll get into the agenda. So Dr. Eva Jewell is with us today, and Elder Chris George, and they will share some of their stories with us, and their wisdom and their knowledge. I ask that you listen with an open heart and an open mind, and to reflect on the words that they share with you today. The information shared today may be tough. It may be tough to hear, but it is important to the work that we do in health, and to remind us that healing is not only physical, but it's also mental, emotional, and spiritual and cultural. Now, with that, I would like to introduce Elder Chris George to the stage.
Good morning, everyone. Or I should say, Sagoli Sagweg, the Wazlak Youngits, Hugwali, Wanyadahaga, Honadashoni. That is my spirit name, the Wazlak. And what it means, and when it was given to me by my grandfather, he told me, he says, when you get older, you'll be able to understand what it really means. Because there's always a meaning behind our Indian names, our spirit names. And the Wazlak, what it means two axes. And when you look at the axe, it's got two sides to it, it represents two ways, the Western way and our way of life, our traditional way, as Hongwe, as the original people. And the thing is that I've walked in the Western world as well as walking in our traditional world. And it's almost like wearing a pair of one on one foot wearing a running shoe, and on the other foot wearing a moccasin. So then that way, you're understanding it. But the whole thing about it is that Chantal talked about residential school, okay? And really that's what we're celebrating today, because the young lady who went to school, she went to school one day with a nice, beautiful orange shirt that her mom bought for her. And when she got there, they ripped it off of her. And it broke her little heart, because it was a residential school that she was attending. And they put a uniform on her. And as she got older, the campaign, which the shirt that you're wearing is because of her. Because her dream did become reality. And throughout all of Canada, this day, September 30th, has been set aside as Orange Shirt Day. And we should be so thankful. I was talking to my son, and he says, did you know that tomorrow night in Toronto, they're going to be lighting the CN Tower, and it's going to be orange? And in respect to that girl, to that woman, she's a woman today. So the thing is that we have come a long way. And I just wanted to make mention too is that some time ago, back in 1967, when Canada became 100 years old, and at that time, I was living with my mom and my brother and my dad in Montreal, Quebec. That was during the Expo 67. But the government of Canada reached out one day, and they reached out to Chief Dan George. No relation to me. He comes from British Columbia, He was a chief of his community. He was an activist. He was an actor. He was a spokesperson. And one of the things when they approached him, they says, "Oh, Chief Dan George, we would like you to come and celebrate Canada's birthday." And his reply back to them was, "How can I celebrate what already belongs to me?" And he went on throughout his speech. But when he got closest to the end, he said these very powerful words, which I like to use. He says, "One day, O Canada, you will see our young warrior men and women rise up. They will take their rightful seats as lawyers, as doctors, as judges, as nurses, as educators. They will take their rightful seats." I've had the opportunity to actually meet the regional director of, they called it medical services, the native branch. And his name was Richard Jocks. Highly qualified educating and also looking after First Nation communities. Another person that I had the opportunity to meet was Harry Laforme from the New Credit Indian Reserve, who became a judge. And he was the Supreme Judge of Ontario, court judge. And also Murray St. Clair, who just passed away last year, who wrote the Truth and Reconciliation to make Canada understand that we still have a voice and we have an education to teach people. And that is what it's all about. So when we're looking at these orange shirts that we are wearing, there's a legacy that we have to begin to follow and we have to begin to understand. We can't just be saying, "Oh, it's just an orange shirt day." There's a meaning behind it. And the meaning is very powerful. And I'm grateful that we are here today celebrating this opportunity. You know, my day started this morning at 6 o'clock with a sacred fire and smoking my pipe along with some other elders this morning. And along with the chief of police here in London and the OPP and our constables from Oneida, all together in that circle this morning. And I felt so good because even the chief of police of London and the mayor was here the last celebration that we had when he was here. And he was at the circle this morning. And it's so wonderful to know that we can all come together with one common goal of learning together. And that was one of the things that the chief of police talked about. We all need to learn. We need to understand them, and they need to understand us. So I understand the Western side of life, but I'm still learning. I'm still learning, and I know you're still learning about who we are. So with that, I just say a big yawat go to all of us. So with that, I say, Nagiwa, Hongiwa.
Thank you, Chris. So with that, we'll move on to our guest speaker, Dr. Eva Jewell. So Dr. Eva Jewell is an associate professor in sociology at Toronto Metropolitan University, who comes from the Chippewa of the Thames First Nation, which is a First Nation just located about 25 kilometers southwest of here. Her research explores the critical role of care and labor in Indigenous reclamation efforts and the unique ethics of care inherent within Indigenous worldviews. She also co-authored an independent annual status update report on the Truth and Reconciliation Commission's 94 calls to action through the Yellowhead Institute. So with that, I would like to introduce Dr. Eva Jewell.
Miigwech Chantal. Miigwech Chris for opening us in a good way. Bojo Nijkewiak, I greet you all today as my friends. Bojo Nindoe Magneduk, greet my relatives. Minogishkat, it is a good day today. Eva Jewell Jaganashi no swin, Deshkan Ziibing Anishinaabe Kwendao. Abjina Mami Kwendam Yaya Mampi. I'm really happy to be here today. And my English name is Eva Jewell. And thank you for the introduction. I am from Chippewas, the Thames First Nation. And my father and relatives are from Oneida Nation of the Thames as well. And I also have relatives from the Lenni Lenape people. My sisters are Lenni Lenape. And so I have a lot of relatives in the in this part of the world, in southern Ontario, and in the Great Lakes more generally. And I'm very happy and proud and grateful to come from this part of the world. I want to say Gichi deep gratitude to the Indigenous Health team here at the London Health Sciences Centre for their hard work in organizing. Orange Shirt Day, this morning you may have put on your orange shirt, and it's really great to see you all in your orange shirts. But there's, for every person who's putting on an orange shirt, there's like 20 community people organizing events for this day, whether it's education events, whether it's our ceremonial events or our recognition events. And that responsibility often falls on our community organizers. Many of them are women, and many of them are, heads of their families or matriarchs. But I just wanted to mention that aspect of care that so many of our people embody to ensure that Canadians hear our message and hear our voice on behalf of not only our nations, but our ancestors who weren't able to make their voices heard and known, especially those young ones and the children in residential schools. So with that, I want to share with you a few things today. I'm going to share today a talk about social determinants of health in Canada. And I want to talk a little bit about the history and how these social determinants of health came to be, and talk a little bit about current issues in Indigenous health and well-being in Canada, and the role of health professionals in reconciliation. So I should share a little bit about what grounds me in this work. So I'm an associate professor at Toronto Metropolitan University. I'm in the Faculty of Arts, and for about 4 years I was the research director at the only First Nations-led policy think tank in Canada called the Yellowhead Institute. And it was there that I did research that was about the accounting for Canada's progress in reconciliation. We started that work in around 2019, just before the pandemic, a few years after the calls to action were released to Canada, and they were released in 2015. And it was because we didn't really see a lot of information out there in the world about reconciliation. A lot of the momentum that we see today about reconciliation really came post-2021 in Kamloops, the post-Kamloops revelations, when there was a discovery of child graves outside of the Kamloops Indian Residential School. So just recognizing that reconciliation has significantly accelerated since then, or at least the observation of reconciliation, but I'll speak a little bit more about what reconciliation really means and what our work is in that as individuals. But first, I want to mention that health and well-being are original and traditional states of living for Indigenous peoples. In my work, I explore experiences of Indigenous carers and Indigenous-specific care issues. And Indigenous peoples have unique original care practices that are rooted in our relational worldviews of what Mohawk scholar Sue Hill describes as the pre-colonial mind. And philosophical distinctions of this worldview is the understanding that humans are not the only living beings with agency. Okay, so it's in the Western worldview, humans are kind of at the tippy top of the importance of life. In our worldviews, we are relational with and interdependent with the rest of the natural world. And so if one species or being goes under, we're all going down with them, you know? So it's really important to recognize that experiencing life, purpose, and responsibility are characteristics of the entire natural world with whom we live in balance as Indigenous peoples, and that's what informs our worldviews around the world. It's kind of an interesting characteristic that many, I should say all Indigenous peoples have in common. And they have their distinctions, of course, geographically and depending on where they're from, and linguistically and culturally. There's all these diversities and unique worldviews, but they share that same characteristic, or we share that same characteristic of the ability to thrive in balance with the world. And that's a feature of our health and well-being. And so when we can't do that, our health and well-being is compromised. And as you know, we are in a state of climate crisis at the moment, and many of us no longer have access to our lands in order to properly steward and fulfill our responsibilities to these lands. And so the original and traditional state of living for Indigenous peoples is fulfilling these care responsibilities. And that is a marker of health and well-being. The second that I have here, and this is certainly not an exhaustive list, but it's our land-based diets and practices. So our original diets and practices are in relationship with land, air, and water, and they are a source of health and well-being for us. So I have here a photo of these Umatilla women in what is currently known as Oregon, gathering roots for medicine. And then our governance practices that uphold what we refer to as natural law, or the universal and natural order of life beyond human embodiment. And that's what Elder Chris had gestured to in his discussion about the two worlds, right? So we humans are dependent on this order. We understand this as Indigenous peoples, and Western world is kind of coming around to understanding this, particularly in academic settings, or but not so much in economic and public settings, unfortunately. We still have the nation-building Canada plan to continue oil and gas extraction, despite the fact that we are currently tipping the scales in terms of our ability to thrive in this climate. So we are dependent on the order of the natural law, and if we are to distill this understanding into a singular purpose, I'd like to say that our purpose of this life is to be a good relative to our non-human kin. And this is, very broadly speaking, the essence of our governance systems that maintain our purpose of good relationship with the world. You see a Haida girl at a pole-raising ceremony, and she's distributing what they call eagle down as part of the practice of maintaining and honoring the relational order of their particular worldviews in what is currently known as BC. So these elements of our health and well-being, they can be found in our original lifeways as Indigenous peoples, but these were violently disrupted by Canadian law and policy, which would be achieved by one of the oldest pieces of Canadian legislation called the Indian Act. And in fact, the Indian Act is so old that it predates Canada as a state, as a distinct state. And this is an act that is still in effect. So residential schools, which were mandated under the Indian Act, would effectively erode our original care practices by dismantling our families and stealing our children away from our families, thereby rendering our worlds abandoned and not allowing for the transmission of our knowledges to future generations. And in my family, there were 3 successive generations of children who were taken from their parents. That's 3 successive generations of children that are not taught their relational care practices and world orders. The reserve system would remove us from our original lands, diets, and patterns of practice by forcing us into tiny parcels of land and splitting our large extended families into separate bands, now called First Nations. So I'm Anishinaabe, and we move around with the seasons. We didn't believe in staying in one place because this would kind of deplete the natural beings that we depended on, whether that was fish or big game animals. And so under the Indian Act, we were forced to stay in one place in a reserve. And our governance orders, which were also dependent on our ability to raise our children and to move around in our lands and to be in relationship with our land, were also outlawed. And still to this day, our original governance practices are not recognized by the Canadian government, who mandates that our political systems mirror colonial norms. And indeed, in our Haudenosaunee communities, there are several congruent simultaneous political orders that exist, one recognized by the Indian Act, the other is recognized by the people and by natural law. And so before 1951, matrilineal societies, like amongst the Onkwe, the Oneida, the Haudenosaunee people, could not be governed by women under this system. And political power and subjecthood was consolidated among men. So there's a violent disruption that happens to our original worlds. And our traditional states of living for Indigenous peoples were entirely upended. And so if you as health practitioners are seeing health issues from Indigenous peoples, know that it's got a root in the legacy of colonial violence. So then I'll shift here to describe social determinants of health, which is a phrase that you as health practitioners are no doubt aware of and deeply familiar with. And this I'm informed here by health researcher Dennis Raphael, who's a Canadian health researcher. And he writes in his foundational textbook that the term social determinants of health grew out of researchers' attempts to identify the specific exposures by which members of different socioeconomic groups came to experience varying health outcomes. And he goes on to note that, quote, while it was well documented that individuals in various socioeconomic groups experienced differing health outcomes, the specific factors and means by which these factors led to these health outcomes remained unidentified. So this research was theorized since at least 1974, when researchers were making links between health and social conditions and economic status. I'll mention here that this photo is from the cornfields of Oneida Nation in Wisconsin, whose crops of native corn varieties and their traditional diets are under threat from climate change. And it reminds us that so many of our traditional foods for Indigenous peoples not only withstood disruption from colonial violence, but are now facing precarious futures under contemporary conditions of climate change. And so in the Canadian context, as I mentioned, these have been theorized since at least 1974, and the contemporary discourse in identifying specific determinants can be traced to a York University conference that Raphael himself had organized in 2002. And in this space, leading health experts identified these 16 determinants of health that are specific to the Canadian context. And these early discussions and publications of social determinants of health in Canada identified Indigenous ancestry as the first on the list of what determined a Canadian's well-being. So I've highlighted it here. This is the first social determinant of health. It has since been contextualized. So if you were to read Raphael's textbook in the contemporary sense, there's been a contextualization of distinct social locations that also liken race, disability, gender, and immigrant status as important social locations that determine a Canadian's health and well-being. And quote, in Canadian society, these social locations are indicators of power and influence and are strongly related to access to economic and social resources, that is, the social determinants of health. So researchers were abundantly aware of poorer health outcomes that Indigenous peoples experienced, and this is thus its placement as the first determinant for many editions of the social determinants of health amongst health practice and discourse. So what does that look like? What does it look like when social determinants of health are determined by Indigenous ancestry? And I just thought I'd share very, very few just a couple of sorry, I'm losing my train of thought here. Okay. I thought I'd just share just a few items. This is by no means an exhaustive indicator of what is the social determinant of health, but one measure of health and well-being is life expectancy. And so we see on average that the life expectancy for Indigenous peoples is currently 10 years less than the non-Indigenous Canadian population. And in the last decade, only 38% of First Nations on reserve had reported good health versus 60% of non-Indigenous Canadians. And of those surveyed, 50% reported good mental health versus 70% of non-Indigenous Canadians. And I'm sure that you as health practitioners can even observe from your own experience, or even from, hopefully from your training, if you've done any work I'm certain that you've done some study of different social determinants of health and well-being. that health disparities exist because of not necessarily because of racial factors or these types of things, but because of, as I mentioned before, access to economic and social resources. And for Indigenous peoples who face poverty and dire economic circumstances in many of our communities, this is a reality. However, health disparities tell us almost nothing about Indigenous peoples themselves. They actually obscure and conceal systemic inequities and often position poor health outcomes as an individual or collective Indigenous failure. And this is very important, I think, to point out that oftentimes these poor social and economic outcomes amongst Indigenous peoples are just not well understood by the Canadian public. And when I'm teaching my students and I ask them in the beginning of my Indigenous Perspectives courses, how much do you know about the contemporary life of Indigenous peoples? And I tell them, don't be embarrassed because there's a reason you don't know this. There's a reason it's been obscured from you. There's a reason that our stories have been marginalized or not accurately told in Canadian society. And I say this in the vein of Shiri Pasternak and Naomi Metallic's similar sentiments in the Yellowhead Institute report, Cashback, which looks at restitution of lands and life for Indigenous peoples and retrieving economic restitution from the Indian trusts and monies that are held in our account as First Nations people specifically. And they state, quote, focusing on poverty statistics in First Nation reserves and cities are well known, and they tell us almost nothing. In fact, they can hide more than they reveal. And so these, there's huge differences between First Nation and Canadian standards of living, and they don't offer any explanation for these gaps. And so they should not be regarded as failures on the part of Indigenous peoples, but reveal the toll of living in conditions of colonial violence as administered through contemporary and current and ongoing Canadian policy. Like, this is really important that I want to say that this is current policy. It might even be policy in an organization. It might be policy at a provincial level. It might be policy at a federal level. But there are very clear restrictions and barriers on Indigenous life and the ways of care that I had described in earlier slides. And so when we look at actual experiences in healthcare specifically, while Indigenous peoples have poorer health outcomes, so they're going to be showing up in your health institutions more frequently, one would think, right? So of course we know that strains and delays are common in mainstream health access. Indigenous peoples are reporting themselves, though, that they have more frequent and longer delays in access to primary health, which is of course a critical source of preventative health care. Over 1/4 of Indigenous peoples are reporting unmet health care needs. Inuit specifically travel significant distances to access health care, and 1 in 5 Indigenous peoples reported experiencing unfair treatment, discrimination, or racism from health professionals, with women reporting in higher numbers. And the majority of Indigenous peoples identified that culturally relevant health care is very important to them. And so I want to mention as well, one of the issues that we have is, in addition to not receiving care that is proportionate to our needs, the data about the care that we receive is generally skewed and very difficult to work with as well. And so indeed, we see that in addition to policy issues and structural inequities, there are a worrying amount of Indigenous peoples that report discrimination and unfair treatment when they do access health care. And so in that way, colonialism is a determinant of health for Indigenous peoples. If Indigenous ancestry determines one's health in a country with colonial roots and ongoing colonial policy, then certainly, indeed, social work researcher Karina Suzuki proposes that colonialism is a broader determinant of health in the lives of Indigenous peoples as well. And unfortunately, it's unacknowledged in contexts like Canada. And so she notes here in this piece in 2011 that colonialism is the guiding force that manipulated the historic, political, social, and economic context shaping Indigenous and non-Indigenous relations. And they account for the public erasure of political and economic marginalization and racism today. And this is what we mean when we say that there's ongoing colonial policy in Canada. So the fact that true history of Canada is not taught in schools, I also worked with curriculum, the Ontario curriculum, and particularly in governance developing courses for grade 10 governance classes or government classes and civics classes. And the amount that I wanted to share and contextualize was essentially disregarded from the curriculum, because it's like, well, we only have this much time to spend on what the Indians do, and then we got to move on. That is a policy choice, right? That is a policy choice that contributes to the ignorance of Canadians, if I can say it that way. And I say this really in the true word, true meaning of the word ignorance, to just not be aware. And so it's these policy decisions on the part of many different levels of society that contribute to, the lack of understanding, the lack of knowing, and the exclusion and erasure of Indigenous peoples. And here we've got a photo of a nurse taking a blood sample from a boy at Port Alberni Residential School, where there were nutrition experiments. And I believe a resource was shared with you leading up to today by my colleague Ian Mosby, with whom I did reconciliation research with, about the revelation of nutrition experiments, which is only knowledge that is 12 years old to the Canadian public, by the way. For many years, that knowledge was not known to the wider Canadian public until 2013, when he revealed that in the archives, in the medical archives. So now, I just wanted to say that colonialism is not a past occurrence, it's an ongoing experience. And as Anne McClintock notes, quote, premature celebration of the pastness of colonialism runs the risk of obscuring the continuities and discontinuities of colonial and imperial power. So as we sit today thinking about reconciliation and reflecting on it, in much of the discourse today, we discuss remembering a time when children were taken. And in fact, children are being taken right now in higher rates than they were apprehended at residential schools. So these systems are ongoing. And child welfare is a very critical part of that ongoing colonial violence. So the Truth and Reconciliation Commission had a 7-year mandate from 2008 to 2015 to hear the testimony of residential school survivors and of experts knowledgeable about its impacts. The 6-volume final report detailed several facets of the system, which operated for 165 years, from 1831 to 1996, and that's longer than Canada has been a country. And resulting from this final report was the 94 calls to action released in 2015, and I believe you were also given a copy of those in your package. The first 42 are the legacy calls to action. As somebody who's studied these calls to action for several years, there is a distinction between the first 42 and the remaining of the 94. The first 42 are the legacy calls to action, which seek to redress ongoing systemic issues in Canada's child welfare, health, education, and justice systems, as well as to support culture and language. So part of reconciliation that is important to state explicitly in the concept is the concept of redress. That is an important explication that we need to make when we're talking about reconciliation. And that means the remediation of systems wherein Indigenous peoples are still facing harm and marginalization. So here are 7 calls to action. The 7 health calls to action, you have them in your package. And while many of these are many of these call for governmental intervention, but I argue that you as health practitioners in your unions, your associations, your classrooms, your organizations, in all of the ways and places that you show up as an advocate for health and well-being, or even just as a practitioner of it, you have the power to lead, particularly in areas such as Call to Action 18, 22, 23, and 24. So even the basic acknowledgement that current health outcomes are as a result of Canadian policy and colonialism, and the recognition of our distinct health rights under international and treaty law has not been completed by Canada. That is a simple acknowledgement. It's not been completed. Not one of these health calls to action have been completed by Canada in the 10 years that these calls to action have been released to the public. So that was my work for several years, is asking and inquiring and keeping it in the ether of Canadian conversations, what's happening with the calls to action. Prior to the calls to action, and actually congruent to the calls to action, there are thousands of recommendations from various inquiries, reports, and commissions about Indigenous life that all describe the inequities that we continue to face, inequities for which Canada is squarely responsible. Okay, and so when Canadians are like, what should I do? I say there's thousands of recommendations in all of these reports. And I ask you to do your research into what your tax money has gone into. Of course, these commissions are publicly funded. So, so for Canadian health practitioners, National Day for Truth and Reconciliation presents a chance to not only acknowledge Indigenous health experiences, but also to think about how you can change the legacy of colonial violence in healthcare. So I ask, that we all do what we call competent care in feminist care ethics, that is anticipating the need, recognizing the environment, educating yourself as to the context as what led us to this point of view, and then determining your next course of action, right? And so a lot of times Canadians want that work, want Indigenous people to kind of tell them what to do. Maybe it's just creating a space for Indigenous peoples to do the work themselves, right? Maybe it's, as Phil Fontaine said, the answer is in our communities, the answer is in our communities, the answer is in our communities. A lot of times we already know what we need to do, we just need the resources. A lot of times we need the bureaucratic red tape to just get out of the way for us. And those are often things that policymakers have, or if you're in a position of coordination or in a position of administration, that you can relieve certain policy blocks for us to be doing our work, because we're working within these institutions that are completely foreign to our worldviews. So, as I said, I worked with the Yellowhead Institute to look at the calls to action and their completion. And Dr. Janet Smiley, who's a physician at the University of Toronto Health Network, noted that the first step Canada needs to take is a recognition of the colonial roots of Indigenous health inequities. And as I mentioned, that hasn't been done yet. We stopped doing this work in 2023, was our final year of tracking the calls, simply because we weren't tracking as much movement as we had hoped, and also to really warrant ongoing reports. Every year we were tracking nothing. And there were only so many times that you can kind of write out that inaction is happening. So we've paused the project. Perhaps if there's more action in the next few years, we could pick it up and reflect on the changes that have happened. But it's my hope that in that pause there will be a significant amount of movement. CBC Beyond 94 is a little more granular in their detail, and I think it's really helpful to look at their work as well. So I shared it here. You can see that 17 are not even have not been started, and these, when you look into what progress means, it's a bit of a I would say it's a bit misleading. Because a project proposed could be that someone wrote a memo to strike a committee to think about completing that call to action, and so then they would mark it as progress toward that. But Indigenous peoples know that we experience justice and change at a glacial pace. Many of our communities are doing without, continue to do without, and continue to work within systems that are hostile to our health and well-being, particularly in states of manufactured poverty. On the reserves, which I know very well, and I'm sure some of my relatives here know well, living and working on a reserve, that the resources and the policies and the bureaucratic red tape create huge barriers to a lot of our well-being. And with that, we had developed these 5 barriers to reconciliation in Canada. What we noticed over the years was this ongoing themes of what really was holding up the progress. So the first you see here is paternalism, and that's that deep-rooted, ongoing, we know what's best mentality that's held by politicians and bureaucrats and policymakers. Then there's just good old-fashioned structural anti-Indigenous discrimination, and this is the assertion of, on a national scale, it's the assertion of legal myths such as the doctrine of discovery or terra nullius that claimed that we weren't here, that we didn't have a proper title to our land, that justifies our ongoing Indigenous dispossession and our subsequent poverty. So it makes it so that we can't actually benefit from the resources that are taken from our lands. Then we have the public interest, and this is an apathetic Canadian public that stands to benefit from exploited Indigenous peoples and lands. We see this particularly in areas like where there's a lot of natural resource extraction and an inability or no desire to really engage or meaningfully fulfill the obligations of reconciliation. Insufficient resources was another one that we saw quite a bit. These are the promises that are made in abundance, but when you don't connect the material to those aspirations, the meaningful reconciliation is out of reach. This can mean things like the promises that the Liberal government made in 2015 that all calls to action would be fulfilled. It can also show up in organizations as well with the performative elements of reconciliation, which leads us to our last point, that so long as symbolic gestures prevail, reconciliation serves only to manage Canada's reputation and really has nothing to do with justice for Indigenous peoples. So while I'm so heartened to see many Canadians wearing orange today, I ask that it doesn't stop there, right? That if you are in a position of power, if you are in a position to do something to whether that is engaging with the Indigenous people in your life who are trying to do the work and making life easier for them, that's helpful as well. Because, you know, it's clear that the mainstream healthcare system is failing Indigenous peoples. If 1 in 5 are experiencing discrimination, there are poorer health outcomes, lack of access to preventative health care, Indigenous peoples having to travel ridiculous distances, and then when they do get there, their care, you know, is hostile. We think of and reflect on Joyce's principle, and reflecting on Joyce Echequan, who lost her life while being mocked, and the extreme indignity that she experienced in her last moments of life. On a policy level, this occurs through underfunding and under-resourcing. One example being the denial of allocating resources for another birthing center because there's already one in the province, right? That actually happened in 2023. The province wouldn't fund another Indigenous birthing center in Thunder Bay in the north because there was one in Toronto, right? Another example is poor data gathering practices that undercount and are not informed by our unique and diverse populations of Indigenous people. So our needs here down in the south vary differently from the people who are in fly-in communities in the north of Ontario. And on a daily basis, this occurs through a spectrum of incompetent care, from inattention to neglect and of specific needs to outright racist practices. So if Indigenous peoples are experiencing poorer health outcomes as a result of this mainstream system, I ask you to consider Stafford Beer's axiom about the purpose of systems. He states that the purpose of a system is what it does, or that a system is better understood by its outcomes rather than its stated function. Is the purpose of the Canadian healthcare system to limit access to meaningful care for Indigenous peoples? Is the purpose to harm Indigenous peoples or cause ongoing distress through discriminatory practices? Because that's what it's doing. A system is better evaluated by its impact rather than what it claims to do. So I ask you to reflect on that the purpose of a system is what it does. I leave you with a Venn diagram that emerged from our research on the calls to action, and consider the approaches of reconciliation and whether they contribute to meaningful change for Indigenous peoples in this country. And arguably, the purpose of reconciliation, as envisioned by survivors and their families and communities, was to bring justice to peoples who had long suffered under violent colonial systems. And is that what it is doing? What is your role in changing the legacy? I ask you, as health practitioners, as providers, as carers, as people who genuinely do care. How does that look in your walk and in your life? Hopefully I can make this available to folks to look at for a longer period of time, but I also want to leave some space for remarks by my relatives here. So in that way I say Chimiigwech, Yago, Anushik. Thank you very much for your attention today.
Thank you, Eva, for that incredibly powerful message. And every time that I, do these events and I reflect and I just think about the work and I'll call it like the heavy lifting that we have to do on these types of days. And I know that we're in a space of learning, like you said, right? We're all in a space of learning, and I really look forward to, to everyone in terms of your learning journey, and that you'll think more about. I think Colleen had shared in her package, the list of the Truth and Reconciliation calls to action on health, and thinking about how that can be reflected in your work. And then also, I think included in the package is a pledge, right, Colleen? So that pledge is really, I'll say, an example for you to review and to look at and think about what does that mean to you in terms of, a pledge. And really when we think about reconciliation, we often use the term reconciliation, so that it means what are we actually doing about it. So I'm just going to share some last words here. So at LHSC, we have a unique responsibility to create an environment where First Nations, Métis, and Inuit people and patients and families and really community members. So I also want to honor some of the community members that are here today with us that came to this event. So one of my aunts is actually here today, Kathy Cornelia. She was actually like a nurse in our community for, it was about 25 years, I believe. Yeah. So she was one of the nurses in our community, probably one of the first nurses in our community. So it's really, it's really empowering to me to be able to see community come to these events and to support the work that we're doing. So we have an obligation to acknowledge the inequities that are part of the healthcare system. And what we will do is we will do our best to remove them. So today, as you leave and you reflect upon what you have learned, we ask that each one of you commit to an action, no matter how big or how small, that will help us advance truth and reconciliation here at LHSC, because when we work together, we can help build a healthcare system that works for everyone. So I want to thank you for today, and I think we might have, we've got about 6 minutes left. So I don't know if there's any questions. Maybe, I don't know, Sean, if you can see online. I can't see the live stream chat at all. There might be something there.
No questions online, but you have a QR code on the next slide.
Oh, the next slide. Okay, so we're going to advance the slides. Am I just pushing the arrow button? Okay, is it there? Okay, so we do have a QR code here to provide some feedback. So if you could, get your cell phones out and provide some feedback for today. And what it does is it helps us improve. It helps us hear from you as LHSC staff on what's most important to you, what's relevant to you, and really how we can do better and improve. So while you're doing that, one of my friends always says I can't walk and chew gum at the same time, but if you can do your QR code, and if there's any questions, because we do have, about 5 minutes left, if you have any questions either for myself, as the lead for Indigenous Health, or for Dr. Eva Jewell.
You guys haven't signed in. Did they sign up when I leave?
Okay, and then sir, the sign in is online too for all of the live stream people?
Yeah, I've already.
You have a question over here? Sorry, I've got low vision, so you'll have to raise your hand and just speak up. Okay.
I have a question about influencing policy, and what's some advice in terms of organizations of our size or systems within health being able to advocate or impact policy change?
Yeah. Eva, did you want to speak to that?
Dr. Jewell, can you repeat the question?
Sure, yeah. So the question was about how to advocate for policy change, is that correct? As administrators or leadership within a structure. I think it's about recognizing policy as sometimes being able to stretch, recognizing and deferring to the expertise of Indigenous peoples. Now, I recognize and I understand that policy is written that way. Policies are usually meant to be, I think, stretched in some ways, hopefully, to change, because if we were experiencing the exact same policy conditions of 100 years ago, we would be living in a pretty different world right now, right? So it's about using your courage or your voice and your power, your influence, to broadening the possibilities that can exist for Indigenous peoples. Hopefully that's helpful. I just spoke to a bunch of ministers I spoke to a bunch of federal ministers and had to express the same thing. So federal ministers themselves and their deputy ministers, I should say, are wondering the same thing. If those people in power are wondering, how do I change policy? Well, who changes policy around here? You know what I mean? So getting that courage and speaking up is hopefully what you're doing. Yeah, thank you.
Is there anybody else?
So I'll just add a little piece on the end there. So we actually have our EDI advisory team made up of LHSC members. So if there's any questions, or we could actually take that question to that team as well. But we're always looking for feedback from folks, even if you're not as part of that advisory committee. So we will take that question forward there. So I appreciate that. Any other thoughts or any other questions? You'll have to raise your hand and kind of speak out a little bit if there is. Okay. All right, well, not seeing anything. So if you haven't signed in, please sign in, and we appreciate that. So with that, I would just like to say a big Yawangko. That means a big thank you in my language, in the Oneida language, and just thank you for your attention today and joining us with the Indigenous Health Team. And we look forward to seeing you at future events, and just a day of reflection for today. So I appreciate. Thank you.
I guess in closing, how many's enjoyed that? You've kind of got a little bit more education, and that's the one thing that's good about that. And we're all learning together to the common goal of walking together in this world. That's one thing our ancestors, when the first Europeans came, we weren't shy. Some of them were sick, some of them were starving, and yet we took time to help them. And yet they did a lot of underhanded stuff to us, but we're still here helping in such research like this. And it's great to learn, but it's also great things to put our hands out and say, we're here to work together. Because one of the things that we have to remember is that there are people out there that need our help. No matter what color our skin is, no matter what nationality we are, we're all human beings. And we have to respect that. It was told to me a long time ago that there's only one creator. There isn't two. But yet, they didn't understand that when they came and they created residential school. And they beat our grandfathers and grandmothers, and including myself. It was mentioned, and I know Kathy went too, we went to day school together at Maldelgan, which was a residential school. But prior to me going to that day school, The first time I went to school was when I was 6 years old. Kindergarten. Because all they spoke was my language. But then when I went to that school, that day school, the same abuses that were occurring in residential school were still carrying on in day school. Okay? And what happened was, because I spoke my language, my fluent language of Oneida, I was forced to speak English. And if I didn't learn how to speak it, because the teacher, what she did when I introduced myself, I said, Saguli Sagwig, Dawazlak yung gits hugwali unya daaga. And I was happy saying it like that. Because my friend George behind me, he says, Tastan, stand up, introduce yourself. So, the only language I knew was my own. So when I spoke it, she didn't like that. And she says, there'll be none of that. Now you introduce yourself, and I did it again. And then she came down the aisle, and she grabbed me by the back of my collar, my shirt, took me in the back, and there was dark corner at number one school. And she took me in the back, and she put soap in my mouth. You're going to stand here until you learn how to speak English. And it was then my friend George taught me how to speak. I failed kindergarten, I failed grade 1. But here I am today. I'm a public speaker. I'm an elder. Still going on. Helping others to understand about truth and reconciliation. I've forgiven that teacher that did that to me. Because I seen her at one of our local fairs, our community fair one year. And one of our elders at the time, she's passed on, she says, there's that teacher. You should go talk to her. I was bitter, but I did. I went. And I asked her, I said, do you remember me? She says, no. I says, you remember number 1 school? I'm the little boy that you took in the back and you put soap in my mouth. But I wasn't the only one that she did that to. There were other kids. But I was able to say, I'm sorry, but I'm here to forgive you for what you had done. And I reached out my hand, and I shook her hand, and I gave her a hug. And that's what it's about. Healing. Healing is a big part of health as well. And the more you begin to start seeing our Indigenous people, help them because they helped your ancestors, and we're going to help each other along the way. So with that, have a great day.